acetabular impingement syndromes, spurring, could they be caused by lack of movement of pelvis? Which could this lack of movement be driven by old falls to the tailbone? Could it be caused by C-sections? Could it be caused by some other things? I have a patient I'm working with for many, many health issues, and one of those is significant hip pain, SI pain, and she's had 2 surgeries for femoral acetabular impingement, where I believe they went in, I think she had some spurring, so they cleaned up the spurring, and tons of physical therapy, tons of work over the years. The very first thing I do with any of my orthopedic patients, regardless of if it's cervical, if it's shoulder, I want to watch them walk, because that's something that everybody does, and it tells us so much. How does this person get through space from point A to point B, and where in the body are they not able to move efficiently, therefore causing compensations somewhere else? So in this woman's case, I watched her walk, and it blew me away because it was so very hard for her to advance her body through space. There was so lack of mobility through her pelvis. So when we break it down, I take her on the table, I take it into leg swing. She can't leg swing, she rotates through the hip. I take her on the table, I try to start mobilizing through the pelvis, and I'll dive into that a little bit more on what we actually need to do deeper for her. But you could see why. Here these hips have gotten beat up over years. So if she went to walk, the pelvis had no movement at all. Significant stasis, which that concept of lack of movement and stasis with regard to actually the venous system also plays a role with some other symptoms she's struggling with down in her legs, and with regard to fertility and her reproductive health. So as we break down the movements of gait and walking, we very quickly can see, wow, she doesn't move well here at all. And her body's going to try to get her through space. And so her compensation, her only option for movement, was to really externally rotate at the hip joint. So when I take her onto the table and I'm trying to assess and treat, how can I restore this motion that she needs through the pelvis for efficient gait, that hip just would rotate and rotate and rotate. So think about that. Right here's this nice little ball that should sit and spin, and in her body it could not sit and spin, because if it didn't move, her pelvis didn't move, if the hip didn't move, she really couldn't get anywhere. So the body's like, I got to figure out how to do this. So therefore we're getting this spin in translation, spin in translation, spin in translation. So what does that do to here? These tendons are attaching to the bone, these muscles attaching through tendons, right? Getting excess pull, excess pull, excess pull. I'm just hypothesizing, but could that be a driver of some of the spurring that is occurring? We know that spurring often occurs in response to excess pressure, excess strain on the bone. It's Wolff's law. We see that right with the plantar fascia. When there's pull on it, extra bone will grow. So I just challenge you to, in all of your patients, make sure you are watching how they walk. How are they getting through space? If you are a patient, notice how you walk. Swing your legs back and forth. Are you able to get your leg swinging behind you? If you cannot, without rotating through, very likely, it would not surprise me if you've got some back issues, hip issues, or foot issues, or even knee issues, because it's so important to have that mobility through the pelvis. So if you've got a therapist who can help you, if not, please reach out. I see patients in the clinic here in Cleveland, and I have fantastic programs that people that I encourage everyone to take online to help balance their bodies inside and out with regard to their structural system. So a combination of both, a great manual therapy